Menopause is more than a life stage. For millions, it's the start of a new, often hidden risk to their heart. Imagine having a heart attack and being sent home from the ER. This is a reality for many menopausal women. The reason? Their heart attacks don't look like they do in movies. There might be no crushing chest pain. Instead, it feels like extreme fatigue, jaw pain, or indigestion. Symptoms easily dismissed as stress or aging. We'll show you why menopause creates this risk, identify the hidden factors, and give you a clear plan to protect yourself. This isn't just about getting older. A profound biological shift is happening. So what exactly did we lose that protected our hearts? The answer is estrogen. Before menopause, it acted as a cardiovascular shield, keeping blood vessels flexible and managing cholesterol. When estrogen declines, this protection vanishes. Bad LDL cholesterol rises, blood pressure climbs, and fat accumulates around your abdomen. This process doesn't wait for your last period. It speeds up during perimenopause, a window where risk factors can rapidly develop. Look closer at your arteries. Without estrogen, they lose their ability to relax. They become stiffer, raising blood pressure and inviting plaque. This collection of risk factors has a name: metabolic syndrome. After menopause, women are 2 to 3 times more likely to develop it. This internal damage is connected to symptoms you can actually see and feel. So which common symptoms are really red flags for your heart? First, hot flashes. They aren't just discomfort. Frequent episodes are tied to a 50 to 77% increased risk of a future cardiac event. The timing is also a major factor. Menopause before age 45 raises your lifetime risk of coronary heart disease by around 40%. And it's not just hormones. Poor sleep from night sweats and menopause-related depression are independent risks that stress your heart. With all these compounding risks, you'd expect the healthcare system to be hyper-vigilant. Unfortunately, that's often not the case. Data shows that postmenopausal women are frequently underscreened and undertreated for heart disease, a dangerous gap in medical care. This gap is not experienced equally. Black women are 3 times more likely to face premature menopause and higher rates of cardiovascular death. This brings us to one of the most confusing topics: hormone replacement therapy. We've been told it's dangerous for the heart. Is that true? The story has changed. Old fears came from studies on older women using different hormones. Newer research shows HRT can actually reduce cardiovascular mortality. We've covered the risks, the mechanisms, and the medical options. Now, let's build your action plan. How do you counter these risks today? The best approach is a holistic one targeting mind, body, heart, and soul. An informed positive outlook goes a long way. Recall the metabolic shift that increases belly fat. This visceral fat surrounds your organs. Generic cardio alone isn't enough to fight it. So the number one lifestyle intervention is strength training. Lifting weights maintains muscle, which boosts your metabolism and supports your heart. Pair your exercise with a heart-protective diet. Think Mediterranean or DASH style: fruits, vegetables, lean proteins, and healthy fats. Proper exercise and nutrition can make the physical changes during menopause a much more positive experience. Staying informed and the right mindset can take you far, particularly with heart health. You cannot manage what you do not measure. Demand thorough heart checkups, including regular monitoring of blood pressure, cholesterol, and blood sugar. Know your unique symptoms and risks. Then implement targeted lifestyle changes like strength training. Partner with your doctor for an informed conversation about all options. Menopause is the moment to take powerful, proactive control of your heart health for decades to come.